With no green grass in sight, some owners are worried about their horses' health.
They're just lazy, more listless a little bit, don't have the energy that they normally would. And so we've just been really kind of taking precautions, making sure they're drinking a lot.
Sandy Maxwell is just one owner that brought her horse in today to have a stomach ulcer check using a scope.
Particularly in horses that's not their normal circumstance. So if they normally have grazing, and then all of a sudden there's not as much grazing, we can see that be a factor that can maybe increase their risk of developing ulcers.
Internal medicine specialist Ben Buchanan says an ulcer for a horse is compared to a chronic heartburn in a human.
Signs that can go along with ulcers, from performance problems to grinding their teeth, some behavioral issues, some pain, mild colics, all those sorts of things can be caused by stomach ulcers.
And if you see these signs, try to get them to a veterinarian as soon as possible.
What we see is that it doesn't take very long for a horse to develop ulcers in the right conditions. So if a horse that normally gets a lot of grazing all of a sudden doesn't, and their stomach gets empty, we can see ulcers start to develop within 5 days.
Dr. Hoyt says certain antacid medications will cure the ulcer, but it's up to the owner to detect the problem. In Navasota, Elizabeth O'Neill, ABC 40 News.